Welcome back. With so many people over the age of 65 taking multiple medications in this country, it's a good idea to know when the wrong combination can make it so your medicines are no longer helping you, can harm you, or can even be deadly. Lisa Sather is still with us to talk about this. Are there certain prescription medications that doctors and pharmacists automatically know they're red flags because they just don't play well with others?
Sure, that's a great question, Beth. I think it's important to firstly mention that medications can be life-saving and necessary in the treatment of medical conditions,
Sure.
But always there's a risk-benefit when we look at that. And so, yeah, there's kind of a group of medicines that we're always vigilant about, and we'll just, mention those. Anticoagulants, or medicines that people know as blood thinners. Warfarin is kind of the old standard that we're used to. There are newer ones out there: Eliquis, Xarelto, Savisa, Pradaxa are the new agents. And then moving on, nonsteroidal anti-inflammatory drugs, those medicines like ibuprofen, naproxen that are used to treat pain and inflammation are a biggie. Medicines with anticholinergic side effects, that's kind of a big word. It kind of refers to the mechanism of action and how they work, but they definitely are things that can cause issues. And then we have benzodiazepines used for the treatment of anxiety, sometimes sleep, those kinds of things, sometimes seizures. They have a red flag for us. And then last but not least, opioids, which are pain medicines used for the treatment of moderate to severe pain. And so those are kind of the 5 big classes.
Let's dig into some of those and talk about some of the more common interactions. Can you talk a little bit more about warfarin?
Sure. So, as a pharmacist, one of the big things, there's a lot of things with warfarin, but one of the things just that folks commonly might get prescribed are an antibiotic, and there are certain classes of antibiotics that can interact with warfarin and cause increase in bleeding. Non-steroidal anti-inflammatory drugs as well. Those drugs can increase bleeding, and so we're always vigilant about that. Herbal supplements can sometimes even interact with warfarin. Garlic comes to mind as well. Another one that recently I came across, I wasn't familiar that this was an interaction, is glucosamine and chondroitin. Folks sometimes take that for the relief of inflammation and pain in their joints. It's an over-the-counter medication. So I think it's important to just mention that anytime you're on an anticoagulant, either the older warfarin or the newer ones, it's important to talk with your doctor. Make sure your doctor or pharmacist understands all of the prescription medicines and over-the-counter medicines you're currently taking.
Okay, and another type of medication that you mentioned in the big 5 there was NSAIDs. Can you talk a little bit more about
Yes,
NSAIDs?
so nonsteroidal anti-inflammatory drugs, some of the biggies with those, a couple of them are blood pressure. And they can actually make your blood pressure medications less effective, so that's something to watch out for. Also, water pills, diuretics, that's kind of along those same lines. Also, as a sidebar, folks that have stomach issues, if they're taking medicines for ulcers or those kinds of things, not necessarily interaction, but those medicines can make your stomach have more issues with being upset and things like that. So we want to watch out with that. Again, back to making sure that your physician and pharmacist are on the same page and they know all of those medicines you're taking, because NSAIDs are even available over the counter. It's not necessarily just a prescription.
Right. Okay. And then another one you mentioned, and this, like you said, is a tough one to say, anticholinergics.
Yes, good job.
Okay, thanks. Can you talk about the common interactions with those?
Sure. So anticholinergic medications, again, that's kind of referring to the mechanism of action, which is more of a pharmaceutical term. That class of medicines are often used to treat motion sickness, gastrointestinal disorders, overactive bladder. Sometimes folks will deal with that as they age. And just by virtue of how they work, they can decrease the saliva we make, they can decrease our stomach motility, they can also cause drowsiness and dizziness and those kinds of things. So some of the medicines that might interact would be medicines for dementia. Aricept comes to mind. Or if you're taking a medication that also causes drowsiness or dizziness and those kinds of things, that can just compound that effect. Antidepressants, some medications that are used as anticonvulsants, and a common one that's over the counter is Benadryl. It's an antihistamine, it has anticholinergic effects, people use it for sleep, allergies, that's a biggie.
Okay, great. And then you also mentioned benzodiazepines. So
Sure.
what are some of the common interactions
Sure,
there?
as I mentioned, benzodiazepines are used to treat sleep, sometimes anxiety, sometimes seizures. They can cause drowsiness, dizziness, confusion. So again, any other medicines that cause those same kind of side effects like opioids, seizure medications, sleeping medications like Ambien that's really not per se a benzodiazepine, but it's like a benzodiazepine. Muscle relaxers, sometimes people are taking those in conjunction because they might have muscular issues. So again, those can all compound the effects. Important to share with your physician and pharmacist if you're getting those from a different provider.
Okay, and last but not least, let's talk about opioids. What should folks be aware of if they're taking an opioid?
Sure, opioids, of course, used to treat pain, mostly moderate to severe pain, typically following surgery. Those medications can cause drowsiness, a decrease in your respiratory rate, decrease in heart rate. So any other medicines, again, that can increase the effects of those can cause more dramatic effects, more dramatic side effects. Medicines that we use for seizures, muscle relaxers are notorious, benzodiazepines are notorious. So we're all going back to that same common thread. Make sure your physician and pharmacist know exactly all the medicines that you're taking to minimize those potential issues.
Perfect. Good advice once again. And we're running up on our commercial again. So one last question here really quickly. Any other common interactions that folks should be aware of that maybe don't involve those big five?
Yeah, insulins is a big one to look out for. Sometimes medicines that are used to treat blood pressure can cause hypoglycemia. That's kind of one of the biggest issues we have with insulin, and that can be very life-threatening if not treated appropriately. Digoxin is a medicine used for heart conditions. There are other medicines that are used for heart conditions that can make it more pronounced and can cause issues. And then ACE inhibitors used to treat blood pressure, also used for diabetes, those kinds of things for prevention. They have typical interactions with things like excess potassium or that can cause them to have increased adverse drug events. So there's a whole host of things. Those are just a few.
Okay, so the main advice there, talk to your doctor, your pharmacist.
The main advice is this, yes.
Let's take another quick break here, but when we come back, do you have questions about your prescription today? Your pharmacist probably asks you that every time you pick up a medication, but do you take that opportunity to ask your questions, or are you just not sure what you even should be asking? We're going to give you some questions you should ask your pharmacist right after this. Stay with us.